Well, good afternoon, everybody. Thank you for joining us today. I'm going to be followed on the program here by our whip, Senator John Cornyn, our policy chairman, Senator John Barrasso, the vice chair of our conference, Senator Roy Blunt, and Senator Jerry Moran, who is the chair of the R-S.D. The Obama administration was forced to admit this last week that ObamaCare is not working as was advertised, and they announced that they're going to delay the employer mandate. Democrats are now endorsing delaying a key component of Obamacare to protect businesses from the very law that they still vigorously defend. While we're glad the administration is finally acknowledging the onerous and costly burden that mandate places on job creators, we believe it's past time the President acknowledges the burden placed on everyday Americans, middle-class families, and those who are already struggling to make it in this sluggish economy. If Democrats believe that businesses deserve relief from Obamacare, what do they think about the rest of America? Today I was joined by 45 of my Republican colleagues in sending a letter to President Obama urging him to permanently delay the implementation of Obamacare for all Americans. Obamacare continues to crush jobs and growth, and it's far past time for the administration to start listening to the concerns of Americans who are struggling under the weight of more taxes, higher premiums, and less opportunity. In fact, in June we saw the involuntary part-time unemployment numbers increase by 322,000, due in part to Obamacare's mandates. Republicans believe we must prevent this house of cards from falling on the American families, not just businesses. Rather than a partial delay for some, America needs a permanent delay for all. Senator John Cornyn.
Thanks, Senator Thune, for leading this effort. For those who believe that Obamacare was a panacea and would provide access to quality health care for all Americans, the fact is that it has not lived up to the billing. And on some very fundamental issues like saving costs, the President said the average premiums for a family of four would go down by $2,500. That's clearly not the case. In fact, premiums are estimated to go up dramatically when Obamacare is fully implemented. He said if you like what you have, you can keep it. Well, that's clearly not going to be the case because employers are going to be incentivized to drop their employer-provided coverage, and then their employees will end up going into the state and federal-based exchanges, which are subsidized by the American taxpayer, and costs will balloon. So what we're suggesting here is that, as Senator Thune said, that if in fact it makes sense to delay the implementation of Obamacare for employers in terms of the employer mandate or the penalty that they would have to pay if they didn't provide coverage for employees, particularly if they're 50 or more, then it makes just as much sense, perhaps even more sense, to delay the additional costs and the punitive impact of implementation of Obamacare for individuals. There are 319 million people in the United States, and they believe they deserve a break from this onerous legislation. Again, it was something that many of us had predicted, but even those who supported the passage of Obamacare have now had to think twice about it. We've seen the repeal of the 1099 requirement. We've seen that 79 senators on a bipartisan basis have voted on the budget resolution their intention, when the opportunity is provided, to repeal the medical device tax because of its negative impact on employment. And we've seen that the impact on full-time employment has been dramatic, and that many employers are simply hiring people on a part-time basis rather than a full-time basis. And finally, that the participation rate, the number of people actually participating in jobs, labor participation rate, is at a 30-year low. So this has had a negative impact. Some might say an unintended impact. Others would say a predictable impact, but one that demands, I believe, that the administration delay the implementation of this onerous legislation for a year at least on consumers. And that's why I'm here to supporting Senator Thune's initiative.
The reason that we actually wanted to work on health care reform, and it was something that as somebody who had practiced medicine for over 25 years I was very concerned about, was the cost of care. That's what the American people were looking for in health care reform, dealing with the cost of care. That was one of the president's original promises, that the cost of people's insurance would drop for a family by $2,500, and that within his first year, within his first term as president. And instead, what we're seeing is the price has gone up significantly. And then just this past Friday, on July the 5th, they've come out with 606 more pages of regulations. You've all seen the red tape tower, the 7-foot tall tower of regulations related to the health care law. Well, now they've added another 606 pages. And you know what it's going to do? It's going to continue to raise the cost of care for families, the cost of insurance for families. And that's what the American people are finding. That's what they believe. And the worst part of it is they believe it's going to lessen the quality of their own care. You have, for every one person that thinks that this health care law is going to help them, 2 people believe it's going to hurt them in terms of their cost and the quality of the care. And that's why this health care law continues to be unworkable. And I'll tell you that as a doctor. It continues to be unaffordable, and it is very, very unpopular. So the law is unraveling, and one of the threads to that was the president and the delay of a year that was announced, but that was just for the business component of it. We need to extend that delay also for every individual, so they don't have to live under the mandates of the president's health care law. We need to get back to the fundamentals of what we were looking for in health care reform, which was what people wanted, which was the care that they need from a doctor that they choose at a lower cost. And all of those promises by the president have been broken. That's why we need to repeal the health care law and build in a step-by-step way the solutions that will get the American people what they're looking for in health care reform.
Yeah, I think it's particularly interesting that so many of the president's advocates have talked about what a brilliant thing this is to put this off until after the 2014 elections. If this road to the new health care plan that the president signed into law 3.5 years ago is such a good road to go down, why wouldn't you want voters to know about it? 3.5 years, almost no regulations issued before the election in 2012, and as soon as the election's over, within 90 days or so, there are 20,000 pages of regulations. Again, if this is such a good thing, why not let people know about it before the election, not after? And then advocate after advocate of the president's position in the last few days have said, politically brilliant, put this off, have the election in 2014 without people knowing any more than they have to know about the new path we're on in health care. You know, it's clearly a path that's not working. One thing after another discarded. The long-term care provision, the so-called Class Act. I don't even remember when Secretary Sebelius said this won't work, but I do remember those of us who were opposed to it said it wouldn't work when the bill was being debated. They didn't even try to implement that, even though the law says that's part of the law. The law also says that the employer provisions will go into effect January 1, 2015, and they say, or next year, and they say no, we're just not going to do that. The small business exchanges, no, we can't get that ready by the date we're supposed to have that ready. That'll be another year. 3.5 years ago, the law was signed into effect. 3.5 years ago, executing the law became the responsibility of the President of the United States. Now, every single election, we say, well, we really can't put this information out there, or we really can't fulfill this part of the legal requirement until sometime after people have voted again. They obviously don't think people are going to like this when they see it. If they thought people were going to like it, it'd be out there. And you know, the other thing besides waiving the employer requirement is they waived the income verification requirement. You all remember that up to 400% of poverty, you get some assistance in buying your individual insurance, but now you self-verify what your income is. There's no way that's a reasonable way to ask people to qualify for a new benefit. That you say what you think your income is going to be with no way to verify that. In many ways, that may even be a bigger announcement that was made at the same time than the announcement that employers don't have to comply. Our view is nobody should have to comply with this flawed law until it's dramatically improved or we find a better course to go down. Senator Thune's letter that calls for a permanent delay is the right thing to do. Let's get started again. Let's make the best health care system in the world work better, rather than head down a path that apparently the administration doesn't want voters to know before any given election where that path takes us.
Thank you all for joining us this afternoon, and I appreciate the comments of my colleagues. In part, I'm here in the capacity as the ranking Republican on the Labor, Health, and Education Appropriations Subcommittee. Fortuitously, we mark up that bill in full committee tomorrow. Among a series of amendments that I will offer to that bill are two that I wanted to talk about today. One, I will offer an amendment to no money can be used to enforce the mandate on business within the Affordable Care Act. And two, I will offer an amendment that says no money can be spent in this bill to enforce the individual mandate under the Affordable Care Act. First of all, we ought to give the opportunity for folks to weigh in on the President's decision to delay the business aspect of the mandate. And secondly, if businesses are going to receive relief from this onerous, record-keeping, time-consuming uncertainty, then individual families, our constituents, the folks back home, ought to have that same opportunity. So delaying the implementation of the business mandate ought to be accompanied by a delay of the individual mandate. And in fact, because of the President's decision, the administration's decision to delay the business mandate, because they admit it is unworkable, it creates greater complications for individuals who are trying to make decisions about having to comply with the individual mandate. It was mentioned that the self-verification, no question but what it creates a significant increase in the opportunity for fraud and abuse within the system, that people announce what their income is to determine whether or not they receive and how much of a subsidy they receive. There will be more individuals who will need to comply with the individual mandate because there will be fewer businesses providing insurance for their employees. Premiums will increase, so insurance will become more expensive as a result of the decision to delay the business mandate. And exchanges, according to the Government Accounting Office, will not be up and running in time for individuals to access insurance through the exchanges. So because of the year-long delay in the mandate on businesses, the burden falls even more heavily than it otherwise would have upon individuals and families. And so tomorrow we'll have the opportunity to take the first step toward trying to change this onerous, damaging piece of legislation that doesn't solve the individual or business problems that they have in acquiring insurance for their families, for themselves, or for their employees. And in fact is becoming ever more clear that the Affordable Care Act, ObamaCare, fails to accomplish its intended purposes. So tomorrow we'll have the opportunity to vote to delay both the individual and the business mandate as we begin the process of trying to salvage a healthcare system that can actually benefit the American people. Thank you.
Thanks, Jerry. Questions for any of us?
I know, let me preface this, in a perfect world, if you guys are running the show, this would never become law, or now the whole thing would be repealed. But short of that, whether it's a temporary or a permanent delay of these mandates, whether you like them or not, they're viewed as some of the pay-fors. And I know a number of your colleagues had asked CBO to look into this, the cost implications. But, I mean, can you talk about that? Surely, you know, delaying them would add to the deficit or the debt, or would you say that it's worth it if you can save Americans from, you know, what you guys described as these onerous burdens?
Well, I get my colleagues to give their thoughts on this too, but I guess my own view is that anything that we can do to delay the impacts of this on the American people is a good thing. And so while we all acknowledge that delaying the employer mandate for a year is a good thing, the individual mandate is set to kick in on January 1st of next year. That's going to hit 6 million Americans with an on average $1,200 tax increase. And you inevitably are going to see, as many of my colleagues have noted, premiums go up as a result of the mandates that are in the legislation. I just think that we would love in a perfect world that we weren't here. We think there's a much better way to do this. But unfortunately, we are where we are. And so anything that we can do in any significant or substantial way to delay the implementation of what we think is a very bad piece of legislation that is going to adversely impact the American economy and jobs and raise health insurance premiums for people all across this country would be a good thing. And the House is going to vote this week on delaying the individual mandate for a year. I support that. We're talking about permanent delay. We'd like to see the thing delayed completely for everybody. I think the administration is coming to the conclusion even more, you had some of our colleagues here in the Senate describe this thing as a train wreck when it comes to implementation. I think the administration is coming to the conclusion this is going to be very, very difficult to implement. And they want to take the parts that are hardest to implement and create the most amount of pain, in other words, the penalty on employers for not complying with the mandates, and put that off, but still kind of hang the benefits out there to try and get people really addicted to the good things that they think are in the bill. But we think the individual mandate is something that it's going to cause people a lot of pain too. There are a lot of other provisions in the bill as well. What else?
Senator Moran, can you talk a little bit about what you're planning for tomorrow?
Beyond what I said, those two amendments will be front and center in our legislative effort to amend the Labor H appropriation bill. In addition to that, I will offer an amendment that will defund IPAB, the so-called death panel, to transfer that money to be utilized for children's health research. And we will offer an amendment to eliminate the $1.4 billion that is in the bill to fund the exchanges. 33 states declined to create their own exchange. This was not accounted for in the original Affordable Care Act. And last year in the continuing resolution, we provided no increase in money for that purpose. The Department of Health and Human Services found the necessary money to do so. And we will utilize the money that would come from the passage of that amendment to increase the support for NIH, health research. What I would say is that in this time of significant fiscal challenges in which we're trying to accomplish a number of things in the appropriation process, the Appropriations Committee should not be paying for these mandates under the Affordable Care Act when we recognize that the Affordable Care Act is falling apart, train wreck to implement. We ought to be using this opportunity to fund the things we know could actually make a difference in the affordability of health care and increase the chances that Americans are healthier. So in my view, the appropriations process is the appropriate place for us to establish the priorities. And the priorities are to do things that increase the health of Americans and not to increase the burden, the paperwork, the bureaucracy that comes from the Affordable Care Act from Obamacare. I would expect Democrat support. I would welcome Democrat support.
A follow-up on the appropriations issue more broadly. One of your Senate Republican colleagues said yesterday that, quote, if congressional Democrats want to oppose appropriations bills without additional Obamacare funding, shut down the government. Are any of you prepared to go to the level where if we come to September 30th, that unless Obamacare is defunded, that we should have a government shutdown?
Appropriators? Want to talk to that? Speak to that?
I think, first of all, we're a long way from September 30th. Secondly, what we need to see for the first time in 6 years is for the appropriations process to actually work. Produce a bill, amend it on the floor. This idea that we only spend the amount of money we spent last year and then subject it to sequestration is not the way to do business. I just think all those discussions are premature. I would hope that the new chairman of our committee, Senator Mikulski, and the new ranking member, Senator Shelby, will be doing everything they can to make this process work the right way. And if it does, there'll be plenty of opportunities to amend that bill on the floor in any way any member of the Senate wants to.
How would these proposals to delay the individual mandate, your amendment or any of them, do they address the requirement to cover people with pre-existing conditions at all?
They do not. They do not. And I think the other thing to emphasize here, too, as Senator Thune said, the administration is trying to put themselves in a position where the penalties go away till after the election. And the penalties provide quite a bit of the funding to provide the resources for people to have assistance to buy their insurance. But they've made the other side of that equation, where you're giving money away, much easier to qualify for by just telling people you can self-verify. There's no IRS check. There's no, I don't even know if there are any penalties if you verify wrong. You just say, well, I made $80,000 last year as a family, which is about, the cap is around 80 or 90,000 for a family of 4. You still get assistance at that level. This year, I think maybe I'll just make about 40. And then you get the benefit as a family making 40, when really you might be making a lot more than that. Nobody believes that self-verification means fewer people apply or you spend less money. So it's sort of the greatest of all political moments. You try to eliminate the penalties, and you try to do everything you can to exaggerate the amount of taxpayer dollars that go to people who want to self-verify their income and buy insurance. But none of these proposals would deal with the crux of pre-existing conditions or any. We think we should actually suspend this bill. There are too many parts of this that now don't work. It's like trying to ride a bicycle with one wheel. And there may be a few people that are pretty good at that, but not very many people are very good at that. And so as this thing falls apart, one piece of the bicycle falls apart, and then another piece. Eventually, you just decide, wait a minute, we got to get a new bicycle. This thing is not going to work, and somebody's going to get hurt. And I think that what's going to happen is people are going to get hurt are people who need health care and health care insurance, not people who need to be part of some experiment that's half-baked.
And if it did get repealed or delayed, permanently delayed, there are ways in which you can deal with the issue of pre-existing conditions, and we acknowledge that. That's an issue that would have to be dealt with. And there are good, we've got good solutions out there, Republican solutions to that. Thank you all very much.